Hello, today I am talking about Huntington's disease. Now you may be wondering, well, what the heck is Huntington's disease? Well, don't worry, this is what this video is supposed to help you about. Now, Huntington's disease is a hereditary neurological disease that is most common in women, but it also involves men too. The age range for the occurrence is like 30s to late 50s. Now, for a little background, or a history check, if you will, George Huntington was the first physician to actually provide a comprehensive description of onset Huntington's disease, adult onset Huntington's disease to be exact, in 1872. Now, the young physician was really just starting his career, surprisingly. He was 22 about the time, and he, in his first medical records, found out what this was, which is quite impressive for that time period. Anyway, this new discovery was a big advancement for what we have now. So, Huntington's disease is a permanent health condition that affects the gross motor skills and the cognitive motor skills. Now, your gross motor skills are what you do to do this and like this. It's how you move. It's all of the verbs you can think of in your vocabulary. Except for, thinking, your cognitive motor skills. So, those you help, think and listen and comprehend everything that you can see or do. Now, unfortunately, this disease only prepares to be worse over time, and on the physical effects, people develop chorea, and that is involuntary muscle movement that makes it kind of seem like you're almost dancing. Balance becomes a problem, as well as eating and walking. They all become more difficult as this moves on, as well as the mental side. Focusing becomes a lot more harder. You develop mood disorders, which is like your anxiety and your depression, and then you become more impulsive behaviors. Now, a lot of people who develop this disease start contracting urge to start gambling more. That has been common in a lot of patients. And then the hypersexuality also starts kicking in during this disease. Now, for the condition, it is inherited by autosomal dominant. So your autosomal is like both sexes could have it, and the dominant means it'll happen in every generation. This is because if one allele is changed in that gene, each cell is sufficient to contract the disorder. The altered HTT gene is passed from one generation to the next, thereby increasing in size with the CAG trinucleotide and frequent occurrence with every repeat. Now, the CAG trinucleotide is basically what is carrying the disorder or the disease. And so when it repeats, it just grows and grows and grows, so that when you pass on kids, you're also passing on that repeated gene that makes it even more common throughout their life. So the life expectancy of an averagely fit human being is death after 10 years of having a diagnosis of symptoms. That's pretty much your prognosis, is how long you live. And unfortunately, it's only 10 years. Life, as I mentioned earlier, becomes a lot more harder in these 10 years, and you can't really go back on any of the skills that you would used to have. Now, Huntington's disease starts in the basal ganglia. It's going to be up here in the picture again, I show you. And this is what initially contracts all your symptoms, because the mental disorders start falling in first before any of the physical stuff actually starts to happen. Now, for treatments, what people see most, I'm gonna speak a quick list, are just people who can truly help with the disorder. However, it's not curable. It's a treatment, so it's something that is going to be stuck with whoever has this for their life expectancy. So some treatments are adult/pediatric neurologists, neuropsychiatrists, and neurophysiologists, and then genetics counselors, social workers, dedicated neurology nurses, and rehab also make it a little bit more bearable to have this disease. Thank you for listening and have a wonderful day.